name is Dr. Risma Choiriyah. I am an orthodontic resident from Universitas Gadjah Mada. Today, I will present a rare and complex case entitled Open Surgical Exposure of Two Horizontally Impacted Maxillary Incisors Combined with Orthodontic Treatment, a Case Report. This journal published in the International Journal Surgery Case Report in 2024 by Dr. Ananto, Alhasyimi, and colleagues. Maxillary central incisors impaction is very rare with a prevalence of only 0.006% to 0.2%. However, its impact is significant because it affects facial aesthetic, occlusion, and even the patient's psychological. They are often caused by supernumerary teeth and often odontoma and trauma. Therefore, early diagnosis and proper treatment are essential. The patient was a 27-year-old male who presented with two unerupted maxillary central incisors. Clinically, he showed that class 2 molar and canine relationship, a deep curve of SPE and edge-to-edge bite. CBCT imaging revealed that both incisors were impacted horizontally with a 19 degrees rotation, and it making the case quite unique. The treatment was planned using a combined surgical orthodontic approach. Passive self-ligating brackets from the Darmawan system were bonded and space was created using coil springs and temporary anchorage devices. The surgical exposure was done in 2 stages using a laser, and the laser minimized the bleeding and preserved gingival integrity. The piggyback wire technique and intermaxillary elastic were used for traction. 1 premolar was extracted to create sufficient space, and adjustments were made for every 5 weeks. The total treatment time was 10 months and followed by 2 months of rotation using fixed retainers. The impacted teeth were successfully aligned in the arch with proper root positioning, and there were no complications such as ankylosing or scarring. And the final results show that harmonious facial aesthetic and stable occlusion and overall patient satisfaction. In this case, demonstrate that open exposure is particularly effective for horizontal position incisors. The use of self-ligating bracket enabled light, control force application, and the laser technique reduced the surgical trauma. The success of the case reinforced the importance of customized and interdisciplinary treatment planning. In conclusion, combining laser-assisted exposure and light force orthodontic mechanics allow for a gentle and efficient alignment of the impacted incisors. This case highlights how teamwork between surgeon and orthodontist ensure and predictable of the aesthetic outcome. Thank you for listening. I hope this will inspire further innovation in clinical practice. Bye!